Welcome to the Beverly Hills Plastic Surgery Podcast. I am Dr. J. Calvert, and I am here with my nosy co-host, Dr. Millicent Rovelo. How are you doing?
I'm good. How are you?
I'm good. Doing really well. I'm glad we're talking about some nose topics because this was a request from our scribe, Kim.
She wants to know why we have not talked about Asian rhinoplasty recently.
We haven't. I was looking because I pulled up the latest podcast that we've done on Asian rhinoplasty, and it was 3 years old.
Yeah, it's due for an update.
There are updates, actually. It's not the same procedure that I was doing 3 years ago. I've kind of changed the game a little bit on how I approach it. How about you? Have you changed your Asian rhinoplasty game at all?
I have not. I went from doing no Asian rhinoplasty to doing no Asian rhinoplasty. But I will cheer you on during this podcast, and I will ask stimulating questions and thoughtful commentary.
Yeah, and we've had some patients that we've done combined stuff where I've done the Asian rhinoplasty, and you've done the breasts and the tummies and all that stuff.
Yeah, for sure. So I can speak intelligently on it, for sure. It's just not my bag of tricks.
No, it's not what you're signing your patients up for tomorrow.
Not at all. But it is a topic that actually deserves more than just a singular podcast. It's a very broad subject in general, as is the terminology Asian rhinoplasty. There's all varieties of Asian within that umbrella. So it's not a one size fits all.
Yeah.
But for the purposes of this podcast, we're talking about Asian rhinoplasty, particularly Eastern Asian rhinoplasty.
Yeah, what most people think of, and this is why I hate the term ethnic rhinoplasty. Yeah. What does that mean? Non-Caucasian or whatever. I don't know. But I think of Asian rhinoplasty as the patient who comes in with a lowish bridge that needs the bridge built up, wide alar base, sort of amorphous tip, and wants to have more definition, a stronger bridge, that needs to be built. And, not necessarily a westernization rhinoplasty, which is what a lot of people also want. That's kind of another topic.
Right.
Because I do very few westernization Asian rhinoplasties. Most of mine are, I'm an Asian person, I want to maintain my ethnicity, but I want more out of my nose. I want more depth and more perspective by creating a bridge, by getting more tip definition, narrowing the base. I want to have a more beautiful version of an Asian nose. That's my practice.
Yeah, and the thing is, every single one of those things you just mentioned, they all have very distinct treatments for them. Those are all very unique subsets of problems that altogether sort of create what's considered an Asian rhinoplasty, because a lot of those common concerns are across the spectrum. And all of them require a really sort of specialized treatment option. This is much different than your standard Caucasian rhinoplasty.
Yeah, I mean, typically, if you see a Caucasian rhinoplasty of some Irish gal with a pretty good hump and droopy tip or something, that's very different than somebody who has less nose than they want.
Less nose, really thick skin, weak cartilages. So let's just go through all the things that I just rattled off. Let's start from the outside. Let's talk about the skin.
Like any rhinoplasty, you have to spend time on analysis. And part of the analysis is, does the patient have thin skin, thick skin, medium skin? Is it sebaceous? Is there rhinophyma, the rosacea? These are all part of the evaluation, because based on the skin is going to tell you what kind of materials you need to build the nose, whether you're going to need rib cartilage, which is kind of my go-to in Asian rhinoplasty now. I don't like failures, and with rib cartilage from the patient or from off the shelf from any of the companies that sell ribs. I am obviously a consultant to MTF, so from that standpoint, that's typically the one that I choose to use. But that's not any other reason. I do think it is the best version of processed rib. I want autologous rib. If I have my choice, I'm taking the rib from the patient and I'm using it to build up the bridge, but I don't like that aesthetic. So I typically take a membrane from the muscle on the side of the head called the temporalis muscle. I make a small incision over the muscle, go through the scalp, take that membrane off the muscle. It grows back.
It's called fascia.
Yeah, it's called fascia, and all muscles are encased in fascia. And I use that with diced cartilage. We basically dice up some rib into 1 millimeter or less cubes.
Think of like a garlic Garlic crusher.
Yeah, it's like minced garlic,
Yeah.
and then and unfortunately the garlic crusher doesn't work because it kills the cartilage. You have to cut it.
You have to
There'll
slice
be little
with the
tiny
knife.
cartilage
Like
grafts.
a little sous chef.
Yeah, so like I usually give that job to like one of the nurses who likes to cook and say, just do it like minced garlic. Put on some sterile gloves and do it. And then we roll up the fascia and zip it up with some sutures and make a little onlay graft. That's really nice for the bridge. And this is a technique that has been around a long time. Roland Daniel and I published on it in 2004, and it's caught on, and people use it all the time, despite what some of our naysayers say. It doesn't get used. It gets used all around the world on a daily basis. But with that said, sometimes you also have to put some cartilage under there because, like, just putting a big fat sausage of fascia and diced cartilage is not the best move.
No, the ultimate goal here is you're trying to build up that bridge and get some height. Because a lot of times what these patients come in complaining about is that their nose sits very low. And so you're constantly trying to build height and you're pushing against that thick skin. So like on the one hand, as much as you're trying to push it up, the skin is kind of like fighting against you and pushing it down. So that's where you say you go to their own rib, because their own rib is going to be the strongest structure that you can use to build that bridge.
Yeah, I mean, you can use implants. I mean, like
Which is very common in most parts of Asia, actually.
Yeah,
to
they use
like Korea, China, all these places, they put implants in, 10 a day.
Yeah, they put in either silicone or ePTFE, which is like a Teflon substance, and it works.
It works. You get
Looks
a bridge. It takes less than an hour, throw that thing in, and if there are no problems, fantastic.
The infection rate can be high.
It's when you have a problem that you have a problem.
It can wreck your nose.
Yeah. So the implants, they're foreign bodies. They can get infected. They can extrude through the skin. We'll see patients coming in, and you can actually see their implant like poking through their forehead or out the tip of their nose. And when that happens, that's a real problem, because now you've turned an Asian rhinoplasty into like almost a no-nose plasty. Like it's a problem.
Yeah, and I have a lot of patients on my Instagram and my TikTok and all that of patients who've had extruded implants that needed, reconstruction. And we published on that about doing immediate reconstruction for the infected implant.
I think I'm on that paper.
You are. Well, you helped me with the cases. You had the idea. We should do this. We should do that. No, it's great.
So that's how you build the bridge. That's how you get some height to the nose. What else do you have to do for the support structure of the nose?
Typically, there's some sort of caudal septal extension graft, which is a piece of cartilage that goes on the end of the septum. The septum is the cartilage that holds up the bridge of the nose. Typically, in Asian rhinoplasty, it's not that high, so we've built it up with the techniques we just described, and then we extend the tip out into space and down into, towards the upper lip with an extension of the septum, which is cartilage that's sewn to the end of it, and we use that to help build the tip and lengthen the nose. Yeah. And it gives you tip definition, it gives you length. It's good all the way around, and especially if you're trying to make, in fact, I just put up a really nice Asian rhinoplasty on my Instagram yesterday, and it looks amazing, and it's such a pretty look, and especially when the patients just want to have a little bit more oomph to their nose, it's really key.
Nice. Yeah, it gives you a little bit extra length, which is often sometimes what they're requesting as well.
And it's strong, especially if you're using rib cartilage.
Right. And then what do you do for the width of the nose?
Typically, we'll bring in the nostrils. That's called alar base excisions. Some people call them weir excisions. I think weirs are a little bit different. It's a splitting hairs kind of.
Whatever.
Yeah, it's a splitting hairs kind of surgical discussion that we don't need for our listeners. But I like alar bases because I tend to take nasal sill. And that's not the nostril itself, but it's the sill of the nose. And I typically do a little combo, a little bit of nasal sill, a little bit of the nostril, and bring it in and make it.
Cinch it in.
Yep, make it narrower. And it does. It makes makes you a more defined nose. It looks great. And there's not, I don't like those cuts up on the side of the nostril.
No, I don't either. I really don't like those.
You see them, they're obvious. They can look weird. They can be flattened. I'm not a fan.
Yeah, the alar crease is that crease on the side of your nostril between your nose and your cheek. And it's a very defined structure. And no one looks at it or even thinks about it until it's been violated, and all of a sudden it's not as distinct a crease anymore. It's a little bit blunted, a little bit flat, and people might not know what happened. They just know that like
It doesn't
looks
look
a
right.
little weird. So yeah, if you can respect that natural crease, that's always helpful. So you've built up the nose, you've lengthened it, you've given it some support, you've narrowed it, you've done a dice cartilage fascia graft. What else? Anything else that you add to
Some
these?
struts. You can do some lateral struts on typically the lateral crura. These little cartilages on the side of the nose over the nostril rim are small and weak in the Asian rhinoplasty we're discussing. So putting in lateral crural strut grafts or articulated rim grafts, which are sticks of cartilage, look like essentially glorified matchsticks that go on the side to hold up the nostril, and it makes for some really nice looking noses.
Right. The whole idea is to build up that tip. A lot of times, like we said, the tip is amorphous and not very defined. So all of these kind of tip suturing techniques and grafts are designed to give the tip of the nose a little bit more of a refined, sculpted look.
Yeah, and I think if you ignore the lateral support, you're going to get weakness and you're going to get pinching actually, and you can get external valve collapse that causes people to have a hard time breathing through their nose.
Right. I mean, the whole thing here really is supporting this nose.
Yeah.
You're doing a little bit of like magical anti-gravity forces of physics work here with all of these grafts.
Yeah,
Because
and-
the nose wants to collapse and go down, and you're trying to make it stay up and support
Yeah, it's
it.
all about tensioning the nose and getting things to balance against each other so that they look great, but also you want to be able to breathe through these things.
Right. So would an Asian rhinoplasty then be considered a little bit more of a complex rhinoplasty compared to a standard primary rhinoplasty in a non-Asian person?
Yeah, I mean, I don't know. It's just different.
It's just different.
Yeah, I don't know if it's. I mean, with reduction rhinoplasties, you got a lot to do. Also, it's sort of the reverse of what we're talking about, but you still have to provide the support even in a reduction. And I think the problems that lead to revision rhinoplasty down the road, if you ignore them, are lack of replacing the structures that
Right.
you've reduced.
Right. So
'Cause,
lack of support.
yeah, you need it.
Yeah. So definitely a different surgery than a standard rhinoplasty, but I think you can get some excellent results, it sounds like.
I like my results.
Yeah.
I mean, I think my patients like them, but I think that there's a lot of different flavors of aesthetics in the world of Asian rhinoplasty. And so I think, like always, if you're trying to pick a plastic surgeon, you should look at the before and
look at the
afters
results,
and
yeah.
understand, what it's all about the results.
Right.
I think
Because
that's just it.
some people come in and they want a really, really artificially narrow, pinched looking nose because they want to be dramatically different from what they have. That's fine. That's a look. You just have to go to the surgeon that's going to give you what it is that you want.
100%.
Yep.
I think that about covers it. So this is the Beverly Hills Plastic Surgery Podcast coming to you from the 90210.